But yet I feel somehow that, I'm still very conservative as a surgeon compared to many of the other spine surgeons who are currently operating. And somehow suddenly I see the last 10, 15 years, this putting the screws in the back, putting this has become like a fashion rather than an exception. And I believe that, through this podcast, I want to tell everybody that every disc doesn't have to be operated. Every operation does not need a screw to be fixed. I somehow think that if there are some very aggressive spine surgeons who are, operating all the time, doing all of those things, I still think that I tell even my patients sometimes, I have to convince them not to get operated. And some of them go and get operated in spite of me telling no, then come back with the symptoms and say, I should have listened to you.
Yeah.
So because the pain is coming from somewhere else.
Mm.
So, if you have a hammer in your hand, everything looks like a nail. It's not so true
Yeah.
in spine, especially like you're saying. It's so multifactorial, the
True.
sources are so different. So I think that, with 25 years of practice and understanding spine as an integral part of my practice, and also running rehabilitation and so many other things, I believe that if aggressive spine surgeons are doing 10 surgeries, out of which only 3 or 4 actually need surgeries, 5,
Yeah.
6 of them don't need surgery. There's so many non-surgical ways of fixing it, including
Mm.
intervention pain like this. And on the other side, if you have 10 of them who are getting screws in the back, only 3 or 4 of them need the screws. Rest of them, we can maintain the, preserve the mobility
Mm.
and the stability and not having to, because by making sure you don't destabilize the spine.